Hi, everyone. Good afternoon and welcome. We'll get started in just a few minutes. All right, thank you very much for joining us today for another ASRP Exchange webinar. My name is Jocelyn Badali, and I am the research lead at the Alzheimer Society of Canada. We are thrilled to have with us today Dr. Danielle Alcock to present another Alzheimer Society Research Program project. The ASRP Exchange is offered through the Provincial Support Program at the Alzheimer Society of Canada. And this series of webinars allows us the opportunity to feature ASRP funded researchers who will speak to the outcomes of their projects while addressing how their results have and will continue to impact people with lived experience. We have Caitlin Jaggers with us again from the Alzheimer Society of Canada. She's our research assistant for the program, and she will help to moderate this session today. And now she's going to present some information to help us guide us through our session today. So I'll hand it over to you, Caitlin.
Thank you, Jocelyn. So hello, everyone. As mentioned, I'm Caitlin Jaggers. I am the research program assistant at the Alzheimer Society of Canada within the Research Knowledge Translation and Exchange team. And I will start off today's webinar by going through the agenda presented here on the slide, and then we will pass it over to our presenter, Dr. Danielle Alcock. Before we begin, please note this webinar is estimated to be under 1 hour in length and is being recorded, but that only the video and audio of the presenters is captured during the recording. The presentation recording, in addition to the PowerPoint slides in PDF form, will be made available on Connection for Alzheimer Society staff, as well as on the Alzheimer Society of Canada's website on our new ASRP Exchange webpage following today's webinar. Today's webinar is presented by Dr. Danielle Alcock and is being offered as one of the ASRP Exchange webinars within our new provincial support program, Meet the Researcher series. We are so pleased to have Dr. Danielle Alcock with us here today to present her project. I honored him until the end, Indigenous Female Caregivers Experiences for a Loved One with Memory Loss. This project was funded by the Alzheimer Society Research Program, as Jocelyn stated at the beginning, starting in July of 2016, with project completion ending in June of 2019. Dr. Alcock is an assistant professor and Indigenous leader at the School of Medicine and Dentistry in London, Ontario. Danielle is Anishinaabe Kwe and a member of the Chippewa of Rama First Nation. She has experiences working as an advocate for seniors' health and patient navigation for Indigenous peoples. Her research interests include memory loss affecting First Nations, Métis, and Inuit peoples, social determinants of health, education and culturally safe care practices, substance use amongst aging populations, and storytelling and Indigenous methodologies. At the end of today's presentation, Jocelyn and I will be moderating a short question and answer period. Please use the Zoom chat box feature if you have any comments you would like to make or questions you would like to pose during the presentation. Please note we will hold off on asking our presenter to respond until after she has completed her presentation. Without further ado, please join me in welcoming Dr. Danielle Alcock.
Thank you, Caitlin and Jocelyn, for all your tech support as we navigate to this strange virtual world we're all in. So just give me a moment. I'm just going to get my PowerPoint going. There we are. So as stated, my research for my PhD work was, the title of it was I Honored Him Until the End, Storytelling of Indigenous Female Caregivers for a Loved One with Alzheimer's Disease and Other Dementias. So before I begin, I just want to acknowledge that I have been a guest for the last 8 years in London, which is the traditional territory of the Oneida of the Thames First Nations, Chippewa of the Thames First Nations, and Lenni Lenape, as well as the Attawandaran people. But also recognizing that London as a city, we're home to many Inuit as well as Métis people as well. Since I've been here, I moved here for school, for my master's, and I ended up staying. So I've been very honored to be in this territory and to have the opportunity to learn from some phenomenal Anishinaabe and Haudenosaunee and Métis women who have really been great mentors and leaders to me for many, many years. So I'd just like to start by saying ani, which is hello in Anishinaabe-Moan, which is the traditional language of my community. Danielle Indigikaz, which means I'm called Danielle. Chippewas of Rama Indujiba, which means I'm from the Chippewas of Rama First Nation. I'm mixed ancestry, and I'm Anishinaabe Kwe. And my community, the Chippewas of Rama, is located 90 minutes north of Toronto on the beautiful Lake Couchiching. My spirit name in English means shining water. And I've been told that the concept of water is the water of traveling of babies coming into this world, or the water that you travel to go back to the spirit world when you pass. And so I was told when I was given that name by the elder that my roles and responsibilities in life will be either supporting those who are entering into this world or those who are leaving this world. And for myself, I was very honored to be a seniors health advocate and work as a patient navigator, to have the opportunity of working with seniors as well as little ones who are just coming into this world and being able to provide support. So I just want to provide an elevator pitch for my research. I have another screen set up, so you'll see me occasionally glance to the right-hand side so I can stay on task. My research focuses on the oral stories of Indigenous female caregivers for a loved one diagnosed with Alzheimer's disease and other dementias, in order to examine the systemic barriers navigating the healthcare system and the importance of accessing culturally safe care. Culturally safe care is the shift in healthcare of the ongoing impacts of colonialism that create and perpetuate disparities in health. Cultural safety is more than competency in terms of knowledge about Indigenous communities, but includes the practices of interactions where people feel like partners in their healthcare journeys for making decisions. And within my research, I also spoke to some really incredible healthcare providers who have been working with Indigenous populations in their community. And they were able to share their experiences of what support that they need in order to practice culturally safe care, as well as the institutional supports to increase their education, knowledge, and their training. And I just want to give an overview of the rates of dementia. On the left-hand side is an image of a lot of Indigenous people call North Canada, the US, and Mexico Turtle Island. And so as you can see here, it's I recommend that you look up some of the traditional stories of creation stories about the creation of Turtle Island. And so I often say Turtle Island to be more reflective of this. But for the rates of dementia in Turtle Island, for First Nations people and American Indians, there's a lot more knowledge that's available compared to those who are Métis, Inuit, or Alaskan Natives, as well as Hawaiian populations. A lot of the recent research suggests that dementia may be 34% higher in First Nations communities than in non-First Nations communities in Canada, and that those rates are rising quite quickly, because Indigenous populations have the fastest growing aging population in Canada as well. When it comes to the Yukon, Northwest Territories, and Nunavut, there's very limited information about dementia assessment and caregiving in these northern regions. And this is a concern. My dog's here, so you'll probably see like a little mouth every once in a while. The joys of presenting from home. But you know, there's estimates that the prevalence of dementia diagnoses are pointing to a 100% increase between 2001 and 2040. And in Nunavut, it indicates that dementia rates are estimated to grow 600% in the next 20 years. The literature that currently exists on dementia rates for Inuit are non-existent, and a focus on health disparities are predicted based on overall aging population rates of national data. So there is really a limited amount of information that currently exists for those who are Métis or Inuit. A lot of the information we have in Canada are focused on First Nations populations, and then the United States, those who self-identify as American Indian. So I just want to give a little bit of the background knowledge that there isn't that much knowledge currently. It's increasing. There's a lot of fantastic Indigenous researchers who are doing this work with community. And I'm very hopeful that with this knowledge, we can enact a lot of change and increase support. So why do I do this research? I included an image on the left of Devotion by Daphne O'Dage. She is a Anishinaabe artist. And for me, I decided to pursue this research because it's very personal to me. And I am actually a caregiver myself. So I can provide a little bit of insight as to my journey and the fact that my experience is quite common to a lot of Indigenous female caregivers because we face a lot of the same systemic barriers that currently exist. So I'll have to take you back to 2013. I was in London. I was doing my master's degree. I tagged along with my now fiance to Scotland. He was going on a work trip, so it was a great opportunity to tag along. And that was back when we were allowed to travel. I know that's something that everyone's really been missing and looking forward to, and spending time with loved ones. And I remember for this, it was really a defining moment in my life. And I'm sure a lot of people can relate that when you reflect back on these specific moments, that they are life-changing, because the entire trajectory of where you're going and what you thought your life was going to be is going to change. So I was in the hotel room on my own, waiting. My partner was at the conference, and I received a call from my mom. My dad had been hospitalized. He had a really bad fall. They were trying to figure out the diagnosis for him. So he'd been in hospital for about 6 weeks. And my mom called me and said, they've come to a diagnosis. He's been diagnosed with alcohol-related dementia. So alcohol-related dementia, it's discussed in literature focused on dementia because the rates are actually recorded as being much higher in long-term care than the literature that focuses on the different types of dementia. An explanation for this is that alcohol-related dementia affects individuals when they are much younger, usually before the age of 60. So they're often excluded from dementia studies in the first place. They're also not being referred to neurology or memory clinics, since alcohol-related dementia is reported for only accounting for about 3 to 5% of dementia in the literature rates. But those who are placed in long-term care home, it's been stated that they actually count for between 10 to 24% of the resident population. So I think this really is a testament that a lot of people aren't getting the supports earlier, education, prevention, harm reduction, which is something I'll briefly touch upon later. So for me, once I came back to London, my whole life became being that advocate for my dad. I was traveling back and forth from London to our community in the Chippewas of Rama. This was also very strange for me. I didn't have a relationship with my dad growing up. My parents separated when I was young. He spent most of his life in the West Coast. We moved all over the world, which is a story for another day. So we didn't have much of a relationship, but I really stepped up to be somebody who I'm very good at navigating the healthcare system, finding as much research as I possibly can, reading as much as I can to educate myself when he received this diagnosis. And that was really tough because there's not a lot of information about alcohol-related dementia. A lot of the studies are focused on autopsies after someone has passed to do the diagnosis. There's not a lot that's actually focused on lived experiences, especially for caregivers who are navigating the difficulty of memory loss as well as substance use. So I think I never saw myself at the age of 25 becoming an advocate, but I'm sure like many people or many caregivers that you interact with, you find your voice when you need to. You step into those roles because you're needed. So when my dad was diagnosed from the hospital, he was being discharged home. We were trying to set up all the plans, and we were told he would have care every day, 5 days a week. So that made everyone feel much more comfortable because he needed nursing, he needed PSW support in the home. But once we got home, we quickly realized that the hospital never actually coordinated with the home and community care center we have. We're very fortunate that we do have a home and community care center in the Chippewas of Rama, but they never actually called to see if they were able to provide the level of care that he actually needed. So unfortunately, once he was home, it became very chaotic and stressful because we realized that he was only going to be able to actually receive about a third of the care that we were told. And so trying to navigate care in the community and trying to navigate if we could access mainstream services that were in the local city close by. And I think this really connects to the issue of this concept of continuity of care. So it's this idea of that you follow the person, and that having those conversations, those of treating people like partners within the healthcare journey, to see what are your needs and how can we make sure this is set up in place so that once you go home, you're not falling through the cracks. With a lot of First Nations communities, there's some assumptions that there are services that are just available, but the importance of making that phone call, of collaborating, of having a relationship with those health centers to ensure that they are available, or if there's gaps that need to be filled. Because it creates a lot of stress on the family to try to navigate this after the fact. And so this is just something that I highly recommend, of making those phone calls, ensuring that everything is set up and not discharging people until they are, because that's a difficult piece. Is once someone's discharged, you can't return back to the hospital. And so it's up to the family to figure out those pieces. And I think it's really a testament that within a lot of First Nations communities, like I said, we have a long-term care center, we have home and community care as well, we have a health center. This is not reflective of all First Nations communities in Canada, that a lot of these services might not be available within the community, such as PSW support. They might only be offered Monday through Friday. So how do you supplement that by offering additional services? The importance of integrating Indigenous approaches to health that include traditional healing and medicines. This is a discussion that we didn't actually have within the hospital context, or even with our coordinator through the LIN. And so I think this is a really good piece of having that conversation with families, if this is something that you want, you need, and then making those connections for them, with also the understanding that I think someone I know always says, you've met one person with dementia, you've met one person with dementia. And that's applicable to Indigenous people as well. We're not all the same. We have different languages, histories, cultures, experiences. And so I think applying that as well, that you've met one Indigenous person, you've met one Indigenous person. So being aware that we have shared experiences within those systemic barriers, but our experiences might be unique. So getting to know the family and their understanding and what their needs are. But that would have been a really great resource to offer. It's something that I navigated myself to find those culturally safe resources that were fantastic, of finding a counselor who had experience of supporting families with alcohol-related dementia, connecting me with elders, connecting my dad with elders. So that could be a really good change and shift that we can learn from Indigenous health, of that holistic approach. It's not just the mental and physical, but what about their spiritual health? What about their emotional health? And this is something I can touch on a little bit later as well. So with the diagnosis of alcohol-related dementia, there's this added complexity of the addiction and behavioral issues, and that people are often a lot younger. That goes with it. So we met a lot of roadblocks trying to access services because of the age restriction as well. Since my dad was living in community, he actually went missing one day. And so with him going missing, we realized that he needed full-time care. It was very stressful, of trying to fill in those gaps. And so the difficult decision was made to place him into long-term care home where he can get the 24/7 care that he needed. The difficult aspect was that in our community, we have a long-term care home. They just weren't able to meet his needs. And so it was recommended to look close by. And so we did that. But unfortunately at that time, long-term care home waiting lists were up to 5 years. So the decision was made to move him to London. We were building new homes here, faster opportunity for that shift. And so he was placed much sooner. And within my research, long-term care, it was female caregivers that I spoke to, everyone ended up placing their loved one in long-term care because they just didn't have the home supports to keep them there. So that would be that, PSW, nursing, social work, maintaining, their connections, whatever that would be, of what their social aspects as well. And so I think this is really a testament to the fact that we have over 630 First Nations communities in Canada, but only 53 are actually located in community. So for the caregivers that I spoke to, some were traveling up to 2 hours one way to go and spend time with their loved ones at a week at a time. Another had a better experience because their community was close to a city where their loved one was moved to, so they were able to be there every day. So that proximity is so key, and trying to keep people at home as long as you possibly can, because long-term care is often the solution because there's just not enough supports that are actually available. And there's also the complexity for those who are Inuit that they're often traveling hundreds of kilometers to be relocated to a long-term care home. So you're being taken away from your family, your community. That's where your ancestors are. That's where your loved ones have been buried. You know your land, your connection there. And so you're removing people, and that can be detrimental to their overall health. So trying to keep people at home is really key. If you are Métis, although they have the same social and health disparities as First Nation or Inuit peoples, they have to access provincial services. Although they are legally recognized under the Constitution, they do not receive the same treaty benefits and federal rights that are afforded to those who are First Nations under the Indian Act. For those who want to learn more about the Indian Act and its long-lasting implications, a great book is 21 Things You May Not Know About the Indian Act. And it actually goes through a lot of the policies, connects it to the past, as well as the ongoing impacts. So that's a great resource if you want to learn more. And for me, stories was the foundation of this research project. It was the story of healthcare providers who are able to share some really positive experience of how they operated differently in terms of taking the time to really get to know some of their clients, and that understanding that there's a level of mistrust that exists for a lot of First Nations and Métis and Inuit families because of the ongoing impacts of colonialism, essentially. And so working through that and building that trust and how imperative that is to relationships. And I really focused on storytelling because it's that connection between the head and heart knowledge. I can give you as many statistics as I like, but I think it's hopefully the stories that will stick with you, because it will be that head heart connection that's sometimes missing within healthcare. They're also a really great tool for people to empathize, understand how their interactions with Indigenous clients can contribute to really great relationships, or the alternative of where they can contribute to really negative experiences. And storytelling is really foundational to Indigenous ways of knowing and being. It's everything. It's how we transmit knowledge, our histories, who we are, and it's our connection. Stories is a way to connect with others and to really come together in a shared experience that you might have. So I always recommend, if you want to make a change within healthcare, use stories, because it will really it will actually touch people in, may sound corny, but you touch people in that heart, and that stays with them a lot longer than if you just give them facts. As I said, my research was really focused on gendered caregiving. And this is common within a lot of populations within Canada. Within a lot of First Nations communities, it's actually predominantly more men are diagnosed with memory loss, whereas I know within non-Indigenous communities, it's predominantly women who are diagnosed, and so their caregivers can be their male partners or their children. And so that was existent within my research as well, is that it was women who were caring for their spouses or for their fathers. And these women were all phenomenal. They did the best possible care they possibly could with little to no supports. And they all talked about that it was an opportunity to give back to those who loved and cared for them. And so they were able to give back in that way of being that caregiver. Although it was really difficult, they talked about how rewarding it was for them. And I think that's also something to be considerate of when you're supporting, is that the idea of that gendered caregiving, asking people if you are going to be their contact, asking them how they are, how they're doing, what supports you can provide if you know someone's a caregiver, and the recommendation of supports or resources that people can go to. A lot of the caregivers didn't know what resources currently exist, like the Alzheimer Society and the wonderful work that you do. And so I think that's a piece too of just sharing that knowledge, even with the health centers that exist within primary care, within Aboriginal health access centers, to get the word out of what you provide so someone can access that as a resource. And a really big thing that came up as well was jurisdictional boundaries. So these are these boundaries, they don't exist. They're these fake boundaries that if you live within your First Nations community, you access services through your band because that's federally funded. If you live outside of your community, then you often have to access provincial services that are available. And so this came up that if you are Métis, you're not able to access a lot of the same resources because you're not given the same rights. Although, as I said, you are recognized as Indigenous under the Constitution. And so that can be difficult. There's some great research out there. I recommend checking out Dr. Janet Smiley, who focuses on Métis experiences, of saying that they are betwixt and between because they're not able to access Indigenous services because of the way that they're funded. But then if they're accessing provincial services, they're not receiving culturally safe care and not an understanding of Métis culture and history and what supports that they need. So that came up as well. And also the difficulty of having to go back and forth between your communities because you don't have the support services that are available at home to keep your loved ones there. And so I think that's really the role of non-Indigenous people, of using your advocacy, of really saying, we need more supports within community, keep people at home, surrounded by those that know them and love them. And so this is really the difficult piece of these rules and regulations that determine what resources you can access based on where you live. And so I always advocate follow the person, as opposed to based on, you live here, therefore your resources are limited to. Should be based on follow the person and what their needs are, regardless of where they reside. Racism was unfortunately quite common within a lot of the experiences of the caregivers I spoke to, as well as some of the care providers, of negative experiences that they've heard of, and trying to, build trust in that relationship. And so I think this is really a testament to the need for education and training for non-Indigenous people. I think it's really important of learning even just the history of understanding your role, that we are all treaty people, to understand what that entails, and that racism can have really negative impacts on families. It can deter you from wanting to return to a healthcare provider for fear of how you will be treated. A lot of caregivers I spoke to would try to visit the long-term care as often as they could to make sure their loved one was being treated well. And for those that had great experiences, it changed everything. They knew their loved one was cared for. They knew that they didn't have to worry of how they were being treated. And so that removes a lot of the stress of knowing that your loved one is being cared for. So racism is still prevalent within healthcare. There's an article that just came out 2 days ago of nurses in Quebec who were fired for making racist comments about an Indigenous woman who had passed. So this is prevalent, and I think the onus is really on healthcare providers of asking your organizations, we need this. Can you please provide this to us? And giving you those opportunities for the training and support that you might need, so that you're able to work a little bit differently. But also being humble, that's a great piece as well. I always recommend a little homework could be check out the 7 grandfather teachings. Those are really good teachings of how to operate and work in a culturally safe way and patient-centered care based on these ideas of love, respect, and humility. So I think you should, look that up if you're interested, if that's something you want to learn more about and how you could practice it. The life cycle came up quite often. I just have an image here of the Ojibwe medicine wheel. It's this idea that when you're born, you start in the east, and at the end of your life, you return, and that you're in the north. And this often came up of people talking about their loved ones returning to childhood. It's an idea of going back, and to that idea that you're going to care for them and love them. But you also have to be cautious. This isn't a way to just simplify the beliefs of dementia connected to the life cycle, but also the opportunity of understanding people's beliefs about memory loss and intervention, of educating people that, these these symptoms are actually not just a form of aging, that they could be a form of dementia, and providing those resources for people so that prevention can be done much sooner. But I think as well with the medicine wheel is the way you treat your seniors, your elders. They're our knowledge keepers. And so just the level of respect and love that's given to them and understanding of their important role in society is something to always consider. And the importance of keeping them in community, because there are language carriers, there are knowledge keepers, they're a link between the past and the present, and passing that to the next generation. So you can really help with, help the next generation by keeping our elders there so that they can learn from them. And this is something I always recommend and came up as well in the literature, is this idea of treating people like kin. The idea that we are all connected. As I said, we're all treaty people. We are all connected. We all have a responsibility to one another, and shifting that in healthcare, of changing the dynamics of relationships, of treating people as partners, a focus on family-centered care that is not just the person living with dementia, but those who are caring for them. And so I'm teaching now, and I try to just tell students of treat people as you would a loved one, because it changes the dynamics of how you view them and what you want that is best for them. It may seem small, but I hope it can have a bigger impact of implementing love and empathy and kindness when you're interacting with those, because you'd want that for any of your own loved ones. And so shifting the way that we perceive people to not be specialist or social worker working with a patient, but that you are coming together and partners in making decisions together. And your role is providing those resources and support for people so that they don't have to go looking for it themselves. A lot of caregivers are doing the best they can. A lot of the women I spoke to were doing the best they can with little support. So if you are interacting with supporting people, find those resources so they can save themselves a little more time, maybe for looking after their own well-being. I think the most wonderful piece that came up was the rewards of caregiving. All of the caregivers spoke about just the level of love they have for their spouses or for the fathers that they were caring for. And so that's really what keeps you going, is that love that you have for them and trying to do the best you can as they're also navigating memory loss within their own lives and how it shifts a lot of aspects for them. And so also focus on those positive aspects. What are the great things that are happening for caregiving? For myself, I have a chance to get to know my dad. And so that's something that I never thought would be possible. And so that's been a really great reward of being able to spend that time. So also focusing on the positive, and how do you support people for those rewards that they have? Is it being able to spend some time together? Is there something that, they love to do together that you can support in any small way? And I think for me, a beautiful thing is art for my dad. He's never been an artist. And so this is something that's actually come up in the last few years. And so it's been very exciting to see this new dynamic for him of who he is, and exploring, I guess just aspects of himself that he never had the opportunity to as well. And so one piece that comes up as well is that art's been such a great tool for him as well with keeping him busy. He still, has addiction. And so being in those spaces, art has been a really great outlet for him, for keeping him busy and engaged and doing something he loves. And so one small thing that the home has done is they've put up these spaces for him to put his artwork. And so his art is displayed. He's engaging with other people while he's doing art. And so it's such a phenomenal thing to see. And so I think as well of the importance that people are living with dementia and to still treat them that way. It's difficult with that loss of personhood. And so fostering elements that are really important to them is really key to that. So this is just an image that it's quite big. It's like 3 feet by, probably 3 feet by 2 feet. And it's 4 Indigenous women from behind. And I'll share another piece of his work. He works a lot with a lot of lines, a lot of symbols. And so it's really fantastic to see these elements that are coming up. And I think as well that what's been so great is this idea of harm reduction also came up. Addiction actually came up with quite a few caregivers and healthcare providers. And so the importance of working with people where they're at, not where you think they should be. And so there was a great example provided by a healthcare provider of a senior who had memory loss and would often try to cross the street to get to an LCBO, and that was dangerous and they could get hit by a car. And the idea of, can we supply alcohol to them so then they're in the home and they're safe? And so there's ways to work with families, especially with addictions for seniors, in order to navigate that in a different way. And working from those harm reduction approaches can really be a great change for a lot of people as well. And so I think art's been a really great tool for my dad as well for keeping him busy and doing something he loves. So I do have some slides about some culturally safe resources, dementia specific resources. So those are things I will pass along to Caitlin to share as well, because I think those are some really great tools that might be helpful if you're trying to find some resources as well. So Chimagwech, thank you. I always appreciate people taking the time to come and listen and learn, because that's what the hope is for all healthcare providers. You're taking the time to further your education and your learnings, and it's appreciated.
Thank you so much, Danielle. That's really wonderful. And also thank you for sharing those images of your father's pictures. I think those are really wonderful. And I know Caitlin and myself, we are interested in personhood and dementia, so it's really nice to see that sort of live in action. So as mentioned, we have a question and answer period. So we're happy to read out some questions or comments that you'd like to make, and we can have Danielle respond to some of those. We have a comment here. Thank you so much. That was excellent. You did touch hearts and the message should stay. So that's for you, Danielle. I just have a question, maybe to get us started. With respect to employing Indigenous methodologies, Danielle, you spoke about storytelling. Do you maybe have some advice for researchers or healthcare practitioners about using these methods?
Yeah, I think storytelling is an avenue for everyone, and it's a change maker. I think it also is an ability to make change at policy levels as well, because of that impact that it can have. So stories are fantastic because you can use stories and you can bolster it with the research that you've done of saying, this is where it's actually happening and I have the proof behind me. But I think that's a great tool for people to use as well. And it's also giving voice to people. Like I said, there's not that much research on Indigenous female caregivers. And so giving them a voice to share their experiences is a great way to understand, okay, what are these systemic barriers that do exist that impact level and the opportunity to care in a really good way, as well as what are the positive aspects of caregiving that go with it too. So having that balance of those experiences and giving the space for people to share their voice.
That's great, thank you. I have a question here. Danielle mentioned some resources throughout the presentation, so we can make those resources available perhaps on our site for the public. We can just have those in a list with links, obviously. And we have a question here from someone in the audience. As a younger caregiver, what are some unique needs you experience in caring for your dad?
Yeah, it was, I think the toughest thing was finding other caregivers like myself. So I was lucky within our community, there's a young caregiver support group. That was life-changing because it was a chance to connect with other people who are in the same, like, you know, that medicine wheel, we're in the same stage together. And so talking about, you know, caring for someone, but if you want to have a family or you're working, then it's pretty complex. So I was able to connect with other people who were in a similar position as me. And I think as well of accessing those culturally safe services that were available for counseling through Indigenous counseling and connecting to elders was really important as well for maintaining my emotional well-being and my spiritual well-being, because I think we forget about those aspects and they're really important. So I think that's key. And as a young person, I burnt out. I got to a burnout point, and it was really, it was not great, but it was good in a way because it was, okay, I need to start caring for myself Because if I burn out, then who's, you have to be well enough to care for your loved one. And so I really, advocate of care for those caregivers, because they're doing a lot of the great work. And so if you can be a support to them, in turn, you're helping their loved one and those that they're caring for. But for young people, it's tough. There's not a lot of resources out there. And so advocating within your own societies of creating young caregiver groups, because there's most likely a group of people who just don't know where to go and how to access supports. So that was fantastic and was really a game changer for me.
Yeah, absolutely. And I think that also your comments about the rewards of caregiving, we often only emphasize the challenges of caregiving, but there are benefits to being a caregiver. And I think also for younger caregivers, there may be even more so benefits, those added levels of responsibility and learning more about yourself at a younger age, having that opportunity to care for someone else. What were maybe some of the other rewards that you kind of gained throughout this experience, if you wouldn't mind sharing?
Yeah, and I think the importance of the value of lived experience. Lived experience is so key, especially within Indigenous ways of knowing. And so I think with that too, is that my becoming a young caregiver also helped me in my work, in what I do for research, because I realized there's a gap here. And so how do we address this? But also I'm able to connect with other people who might be caregivers, because I get it. And so I think that's helpful too. So those who have lived experience, share it, because there might be somebody else who is going through the same thing and thought they were alone. And so making people realize, hey, you're not the only one. That's really awesome. And so I think that's a reward as well that comes from it, of sharing your story, reducing some of the stigma that is attached to talking about substance use, because there's a lot more people than we realize that are being supportive and trying to navigate the healthcare system. So sharing your story can really have a good impact on someone.
That's great. Thank you. I have a question from another audience member asking maybe if we could speak a little bit more about the medicine wheel. I'm wondering if you might be able to, I know obviously that we wouldn't have enough time to discuss the history, but maybe if you could give us a little bit of a synopsis for some people who are unfamiliar with the medicine wheel.
Sure. So the medicine wheel is reflective of often Cree and Anishinaabe, and it's this idea of living the good life. So Minobamadzawin, which is living the good life. And so it's this idea that as you go through these different phases, there's different aspects. So as a child, it's other community members who are teaching you how to live the good life. Once you get into adulthood, it's your turn to learn how to live the good life. And then as you navigate and you get older, it's how do you give back to teach people. So it's really this idea that each stage of your life, there's important elements that go with it, but also each aspect of the medicine wheel represents a different aspect of self. So it's the emotional, the spiritual, the physical, and the mental, and that each of those need to be in balance, because if one is off balance, then it will have impact on other aspects of your life. And it's also this idea that with health, it's a lifelong journey. It's not something that you just achieve and you're great. It's not living, health isn't the absence of illness. It's just this idea of how do you have balance within your life, and that you could be living with a chronic illness, but there's other aspects of your life that balance that. And so it's really this idea of that balance, the idea that as well, the important role of community, because it is really community and family that help bring up that little one, and then you give back. And then once you're older, it's those little ones that will look after you. And so I think it also is a testament to the importance of those intergenerational connections between different age groups that goes with it as well. So it's something you can easily look up. There's some really great resources online that talk about the medicine wheel and the important aspects of each. But I think it's a good tool to use as well when you're working with people, of talking about their mental health, their spiritual health, emotional health, and physical health. So you can grasp a picture of what are some elements that you could be supportive of.
That's wonderful. Thank you for sharing that. And I guess you also spoke a lot about the holistic health aspect and, some people's personal beliefs about aging and memory. That's a very diverse, it can be diverse amongst the people that we're working with and practicing healthcare with. Another question about your experience working with female Indigenous caregivers that you spoke to. viewing dementia as a bad thing, or something to be fearful of, as many non-Indigenous individuals might feel that. So the question is wondering if it is viewed as sort of a part of the circle of life, as you touched on regarding the medicine wheel, reverting to childhood, or perhaps it's viewed more as a natural process of aging versus abnormal.
Yeah, and I think that's the complexity of memory loss. People are going to have different ideas of it as well, and getting and understanding people's ideas of what is memory loss, but also that importance of that knowledge translation and education of, well, what are the signs and symptoms of dementia? When should people focus on prevention? That's a big piece too. We're often so reactive of once somebody is diagnosed, then people get the education and the training to find out as much as they can. So can we educate younger populations, those who are in their 40s, of what can you do to prevent, to have that healthy brain and connection to aging? Can we educate younger people as well of what are the signs and symptoms of dementia? Because everyone knows someone who's been impacted. So then everyone can have that knowledge of how can you be supportive, and that earlier prevention piece that goes with it as well. There's a lot of discussion within the research focused on Indigenous memory loss. This idea is that dementia is a new disease, because for us as well is that we have longer life expectancies now. And so with the longer life expectancy, memory loss is connected to aging. And so we have an increase of populations as well, because we have longer lives now. Also that connection to the shift of life, access to our traditional foods, access to our traditional territories, which is connected to being out on the land, and that connection of that, your spiritual health, your physical health, that goes with that. And so those shifts have had long lasting impacts as well. Traditional food is really important. That connection, it's not just the food, it's where does it come from? What are the activities of picking that food, the knowledge that comes with it as well. So there's a lot of complexity that definitely comes with it. But I think with the Indigenous approaches to health can have some great benefits for all communities as well, of working with people, the holistic approach, and also that importance of that connection to place is really key. And I think that's for a lot of people. Because that's where your memories are, that's where your people are.
Thank you for sharing that. And sort of maybe shifting gears now, I'm wondering, just with respect to the past year, what has maybe COVID-19 had on, what implications has it had on some of your current work or research? Obviously, you were fortunate to be able to conduct your research before all this happened, but I'm just wondering if there are any implications that maybe you're looking at now.
Yeah, I think the tough piece with COVID-19 is that there's other health concerns that are happening within communities as well. So also being cognizant of that when is the right time? You have to work with communities when it works for them. And so that's something as well and Indigenous research is usually a little bit slower because it's taking the time of relationship development, of finding out what the needs are, adjusting it to what are going to be how is this going to be useful? How is it going to be applicable within your community? And so I'm very fortunate to be connected to Team 18 through CCNA. They're a phenomenal group. Check them out because there's some great researchers there available as well. They've also created a Indigenous cognitive assessment called Kika that is applicable within Canada. So that's a great tool that can be used as well. That's been developed with, by, and for Indigenous communities. So things are a little bit slower because communities are focused on COVID-19 right now, and having that understanding that there's other priorities at the moment, and just being patient to work when it works for them.
Yeah, that's great advice. Thank you. I'm wondering if maybe we could also speak a little bit to the importance of funding for your work. Obviously, it's beneficial for researchers to get support from health organizations and governments. I'm just wondering if you could speak a little bit about that.
Yeah, funding is key. And so with this program, I try to tell as many, the next generation of Indigenous researchers coming through of apply to this program. It's fantastic because of all the support that's provided, the opportunity of sharing your knowledge as well. So I always recommend this for other Indigenous researchers, but I think that's a piece too of ensuring that there's opportunities for communities to engage in research, because that's a big component of them having the funding to be able to do what works for them, and that researchers, we can be there as that support as needed, but funding is imperative. And so it's great that, you know, like as I said, in the last 10 years has been a increase of Indigenous researchers and communities that are really taking the lead of doing this work. So it's absolutely awesome, because it's doing work that's going to benefit at, you know, for their specific community, and has long lasting impacts in that way.
Great. Thank you for sharing that. I'm wondering if maybe you would like to share with us, maybe there's one thing you'd like someone to remember about this presentation and about your project. What might that be? What's something that you really want people to reflect on and remember?
I think as healthcare providers of you know, of doing the work of learning what communities you live close to. Do you know about the communities? Do you know what services they provide? Even just, you know, introducing yourself is a really key aspect of knowing, hey, we're here as a resource and how can we be supportive? I think as well that of kind of when you're working with Indigenous families, of check out the 7 grandfather teachings, because they're a really good tool of how you practice with people, and how you interact. And humility is key. It's okay if you don't know everything. Like, no one expects you to. And I know that's tough with healthcare, because, you know, you're kind of expected to be the specialist and have all the knowledge. It's okay to be humble and say, I actually don't know that much. So as we navigate this together, I might make some mistakes. I'm doing the best I can. I'm going to learn more. And people are usually, they like that. You're being honest, you're being truthful of where you're at in your journey. So that's a good space as well. And then importance of trust. Trust is really key for that relationship development. So taking the time to really, you know, be there. That's a piece, just be there. And that came up from a lot of healthcare providers, of they go that extra mile, of practicing culturally safe care with their clients, whether that's ensuring that you have a translator available, making sure transportation is set up so that someone can come into your space and access services for themselves and their loved ones. So it's small things, but it really contributes to relationships. So keep relationship foundational to the work that you do. Be truthful in the way that you operate, and it can really take you quite far.
Thank you for sharing. Yeah, that's very true, and also lends itself well to the holistic approach too, I think. Sorry, I think we just have one here. Can you, well, we will post some of the other links and resources that you mentioned, but someone said, could you just repeat the dementia assessment tool that you spoke about? What was
Yeah,
that?
so if you go to CCNA Team 18, it's listed, there's some great resources there as well that they've actually created about what is memory loss, that you can actually share with Indigenous communities. That's a really great tool. I made like a little resource guide for Southwestern Ontario, so I can share that. It's just a list of resources that people can access within community, whether it's housing, finances, navigating medications, non-insured health benefits, which provides funding for status First Nations people to access if you need devices, medication, changes in your home, counseling services, social work services. So it's just a good tool to kind of go to if you're stuck and you want to find some good resources.
Thank you. So that's the Canadian Consortium on Neurodegeneration and Aging, CCNA Team 18, and we'll provide those links as well with this recording on our webpage. So Caitlin, I think, has a couple of comments that she's going to read out for you, Danielle, and just going to move us over to the next slide just to let everyone know about our next webinar on the April 28th.
Thank you, Jocelyn. So I just wanted to share some of the nice comments that were written towards your presentation, Danielle. So an individual just shared that they thought it was beautiful and powerful, incredibly insightful and informative. Just thanking you for sharing your personal experiences as well as your research really meant a lot to a lot of the audience members, saying that they were humbled by your words and your experiences, and just overall thanking you for everything that you shared with us today. I believe it had a great impact on everyone that listened, and really was a meaningful presentation across the board. So thank you on behalf of all the audience members, as well as the Alzheimer Society of Canada. It was a great pleasure getting to listen to you today.
Well, Chimagosh for having me, and thank you for those who came to just come and listen with an open heart. So I end with that of always try to listen with an open heart, because people can tell and they appreciate it.
Wonderful. Thank you so much, Danielle. And just to let everyone know that the registration is open for our next ASRP Exchange webinar with Dr. Jordan Ali. And his ASRP project for his doctoral award was on, is entitled Objectivity and Subjectivity in Cognitive Decline, a qualitative study of concerns and complaints in older adults. So we look forward to having you there for that next webinar. And again, Danielle, it's been a pleasure and an honor to have you with us. And we're so fortunate to have been able to fund your research through the Alzheimer Society Research Program. And your last points on just remembering honesty and communication and humility. I think those are things that we definitely would like to practice more in our work. So thank you for that. All right. Thanks everyone and have a great day. And if you have questions, please email us at research@alzheimer.ca or the PSP@alzheimer.ca for our Alzheimer's Society staff members. Thank you so much everyone and take care.